I'm just having radiating pain down my leg, my right leg. Sometimes it goes all the way down into my calf and even in my toes. It's not like something I've been through before, and I've been getting regular treatment for 2 months, and not much has happened.
Got it. How long has this probably been going on?
Since January.
And you mentioned about something that's been going on even before that.
Yeah, I mean, I would throw out my lower back, basically. And, you know, a week or two of regular chiropractic visits and some physical therapy, you know, I bounce right back. But I don't know what's happening now, but it's not going away.
Starting off with instrumentation, we're looking for, is there any abnormalities in temperature? And we got a potential filler right over here. So right now we're scoping right over the 5th lumbar area, where you're traditionally used to have pain in that area, and I'm not finding anything there. But when we go lower down to the sacrum, and there it is. We have a reading here, not at the 5th lumbar level. Let's take a closer look. I understand you feeling traditionally pain over here. Yeah. There is swelling to support that. Okay, so I'm not saying you're making this up. No, we do see objective data. There is chronic swelling here. But right now, when we challenge this, how's that feel?
Yeah, that's
pain. Okay. How's this feel? That's the worst.
Yeah, it's as you press it, it's going down the leg.
It's going down your leg. So we duplicated the pain. All right. So just double check one more time. Which one's worse? This one over here, or this one over here?
Oh no, the lower.
The lower. So what we just challenged and tested, this is the 5th lumbar. So while it does have some pain, and there is some chronic edema over here, this one duplicated your pain and also elicited more pain. This is the fellow we need to correct on you. Because what I found on this x-ray over here, and that would have confirmed the MRIs when you bring it next time, that fellow right there. There should not be an open wedge on this 2nd sacral segment. So yeah, there's a tiny little bubble right there. This sacrum is supposed to come when we're first born 5 pieces, and we get older, merges to one bone around roughly 30 years old to 35. It's supposed to be one bone, unless there's some kind of trauma you experience that forced it to gap open. And that's what happened right over here. Okay. So it's gapped open in the back. We tested it. Yeah, pain and duplicates the sciatica pain going down. This is the fellow we need to fix on you. Let's roll. Okay, draw out the belly. Let it go. Right there. Let it go. Draw out the belly. Oh, there we go. Oh, right there. There we go. Good. Ooh. Come on up. All right. Walk around, champ.
That was
No, it's powerful.
That's just gone.
What's gone?
That pain that I was having. Wow. The pain I told you was resonating down to my calf, my ankle. It's crazy.
Why don't you have a seat? You said pain brought about when you sit too long, right? How's it now?
That's crazy. Yeah, it's gone. I mean, when I slouch a little bit, but it's very faint. I'm sitting up.
Okay, do me a favor. Go ahead, stand up.
Yeah.
All right, so this is your homework at home. To deal with that 2nd sacral segment, as you see over here, this is number 2. 1, 2, 3, 4, 5. Number 2 over here, as you see, is connected to your right hip joint and your left hip joint. So every time you walk, this fellow over here, it's moving and it's rocking forward and backwards like a seesaw. So every time you walk, try not to walk too much. It's sort of like walking on a fractured foot. It's not exactly a good idea. Exactly. So we want to. So in other words, running, no. Jogging, no, not a good idea. Including walking upstairs. You could do 1 flight of stairs. I don't advise more. Why? Because when you walk way upstairs, it rocks it really forward and pushes it much more forward, knocking this fella out of alignment once more again. It also doesn't like sitting. Now these are our 2 sitting bones over here. As long as you sit completely upright, you're fine. But what do most of us do? We slouch. So when we slouch, The sacrum over here in the coccyx bangs and hits a cushion, forces this structure over here to knock backwards. And that's what got you into trouble in the first place. So try not to sit too much. I know you drive quite a bit because of your work. I recommend get a cushion for that. Just in the meantime, it usually takes 2 to 4 weeks for this fellow to heal up. You follow what I say and do our directions over here, you're going to be just fine. If you knock it out a second time, it'll take 3 to 6 months to heal this thing up, and it won't be easy.
Got it.
You probably need another follow-up visit approximately 2 weeks down the road.
Okay.
That's it, champ. We're good to go.
Great.
Oh,
Thank you very much.
you're very welcome.